Hi there, welcome to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This month, we're going to be discussing screening tests. This is one of those topics that patients often shy away from. The kinds of things that I tend to hear are, why do I need to see a doctor if I'm feeling just fine? Or isn't that asking for something to be wrong? Or I don't have time or money for that. So, to answer each of those questions, you should go in to see a doctor when you're feeling well so that we can help you to stay well. It's not asking for something to be wrong, but rather screening and monitoring so that when we catch anything, we catch it early enough when interventions work best. For most insurances, screening tests, when completed at the appropriate time, is covered, meaning no additional out of pocket cost to you, and oftentimes there is also no copay. Also, once you begin to have symptoms, the testing conducted is no longer considered screening. It is now diagnostic, meaning we need to figure out what is causing the symptoms. There are many different types of screening tests that we do, but I'm going to focus on what we tend to do at a physical exam this week and other screening tests in the coming weeks. Oftentimes, patients will come in requesting to have tests completed that are not necessary. Sometimes those tests get ordered for various reasons, but not necessarily because they're needed. So, what screening tests do we do? These tend to be determined based on age, BMI or body mass index, and other risk factors. The USPSTF, which stands for United States Preventative Services Task Force, gives us recommendations regarding when and which screening tests are necessary. Let me go through some of the recommended tests. For an adult coming in for an annual physical, we start the visit with vitals such as a blood pressure for those 18 years old and older to assess for high blood pressure or hypertension. We also evaluate the height and weight, which we use to calculate the BMI to assess for overweight and obesity. If you fall into either of these categories, we then do additional lab tests, such as a lipid profile to check for a cholesterol level, a hemoglobin A1C to assess for diabetes, and liver function tests to assess the liver function, and a fasting glucose. To evaluate for lipid or cholesterol disorders, we do a lipid panel for those at increased risk for cardiovascular disease. People who fall into this category are those who are obese or overweight, like I mentioned before, those who have diabetes, those who have a family history of lipid disorder or heart disease. We also screen for depression and suicide risk in the general adult population, those who are postpartum or pregnant women. In this same visit, we will ask about your social history, which in short includes tobacco and substance use, a sexual history, and family history, all of which helps to inform the testing that needs to be conducted. The takeaway points for today are an annual physical and relevant lab tests are covered by most insurances and most often without an out of pocket cost. Overweight or obesity will increase the lab testing being conducted. The family history and social history will help to inform those specific tests. Once you are symptomatic, testing is no longer considered screening, it is now diagnostic and does not follow under the same umbrella as an annual physical. Come back again next week and we will continue the conversation on our journey to amazing health. To book me for a speaking engagement or to connect with us on social media, use the platforms on Twitter, Facebook, and Instagram at Amaize Health or the website www.amaizehealth.com. I will continue discussing various health related topics on this YouTube channel, and as you listen, be sure to like and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.